Good day, friends of Buzzy. How are you guys? So, sorry I missed on Friday, but today we are going to talk about the effects of coronavirus and mental illness, both in adults and in children. In addition, we'll talk about what's new in the vaccine world and a couple other interesting studies that I read over the weekend. And then finally, we'll talk a little bit about pain management, circling back to something that people may not have tried early on, but now maybe you've been home enough that you're willing to give it a go. All right, so first of all, let's talk a little bit about the research and the situation with mental illness. Prior to the coronavirus epidemic, one of the biggest medical issues, if not the biggest, was opioid overdoses. And in fact, the last year for which we have statistics, 2018, 42,000 people died from an opioid overdose. Those people who have addiction issues have not gone away, they've just lost access to where they can get their medications. And so there is a terrible tragedy with Melissa Etheridge's son, a 21-year-old, who passed away from an opioid overdose in the last 4 days. And the numbers of calls to mental health hotlines and to overdose and substance abuse helplines have increased 2 to 3-fold. So here is the good, the bad, and the ugly about mental illness and coronavirus, and what we can do about it. So first of all, the good. Indiana has a program that was just approved within the last 2 days where they're going to be giving $1 million, which is about 25,000 doses of Narcan, of naloxone, the drug that reverses an opioid overdose. And if you saw Pulp Fiction, you get the medicine, you don't actually have to stab it, you can just snort it. I mean, it works just fine up the nose. I have given that before as an emergency physician. Actually, let me just tell you, giving Narcan to somebody who is overdosed is one of the coolest, badassiest parts of medicine there is. So this one kid came in, and he was a cancer patient, and he was very, very small. I mean, like a 4-year-old, and he wasn't breathing right. He was we call it obtunded, but I mean, just not responsive. And turns out that his caregivers had put fentanyl patches on in 2 different places, but they didn't tell each other. So he was getting double the fentanyl. So he was not responding and not breathing well because he had an opioid overdose that was kind of ongoing. And so when I checked him out and I looked at his little pupils, I was like, oh, you know what? Let's try some naloxone. And so it's just astounding. So gave him some naloxone, put it through the IV, and he went from just barely responsive, we're going to have to intubate him, breathing, to sitting bolt upright and saying, I want a popsicle! So solid. I mean, just putting a nursemaid's elbow back and giving somebody naloxone in the pediatric emergency room, such good feelings. I'm sure that it's a lot different if you're an emergency responder who has to resuscitate people over and over again, and when they wake up, they're not nearly as happy about having been woken up. But another issue. So good news is, Indiana, 25,000 doses of naloxone coming at you. That's great. There are 2 interesting studies looking at mental illness and coronavirus itself that are worth talking about, because there's a huge difference in how adults are handling stress and kids. So it turns out, a study that's, again, one of the meta-RX IV ones, so it hasn't been peer-reviewed, but they did analysis and interviews of about 200 adults and found that their stress levels were approximately the same on weekdays and weekends. So what this means is that there's a huge difference between stress and mood on work days and then weekends. And so for a lot of people now, the lowered stress of weekends is gone away because you're not going out with friends, you're not decreasing stress, you're not elevating your mood. So for adults, what's really happened is not a huge escalation, it's just that stress and mood are up to here. Now the average age in that study was 42 years old. There's a different study that looked at students with an average age of 22, and the results were dramatically different. Now, first of all, as you might expect, 70% said they're using more social media and online more, figures, but 54% said that their highest source of anxiety was online learning, and I've got my numbers written down. Oh yeah, and this was terrible. So 12.9% of these average 22-year-olds reported taking more medicines or illicit substances to deal with stress. So 12.9% more is a lot when you think about the fact that they can't get out. So they're limited to taking medicines and anxiolytics, stress reducers that are around the house. You might have seen the Saturday Night Live last weekend that had the song called "Let Kids Drink," just for coronavirus, just for a little while. Come on, Child Protective Services, let kids drink. And they had a lot of their children running around with beer bottles, and they had a bunch of toddlers who'd fallen asleep, and they put wine bottles around them, I hope. It's something that is being joked about because it's a stressful thing. But if you have opioids around your house in your medicine cabinet and you've got teenagers, know that more than 1 in 10 of them are starting to try to find something to do to get rid of their stress. And that leads to overdoses. So we're going to put the mental health help hotline number on, but I think it's important to know that while adults may only have their weekend stress level raised to weekday all the time, and that may eventually accumulate and cause issues, for our kids who are on average 22, they're experiencing some real distress, and about 1 in 10 of them are turning to substances. So that's news you can use. Now, what does this imply for us as a society? Well, there's another study that came out that is in a video too. You might have seen it. So this was from Japan, and they put glow-in-the-dark paint on someone's hand, and then they had them have a normal dinner with each other, and then by the end of the night, they put black light on everybody, and they've got people with smears of glow-in-the-dark paint everywhere, and you can just see if this were a virus, you're all doomed. The interesting part about that is that inside a closed room, another study that came out showed that yes, being inside a room does lead to more transmission than being outside, but it's not aerosol. Inside a room, it's still usually contact, which means that for these young kids, and when we're talking about going back to college, the likelihood is that if they themselves do not have underlying conditions while they're away at college and not risking bringing this home to a parent or a grandparent that they live with who's more at risk, there are ways to mitigate spread. And it's worth considering that the risk of 12.9% of our young people turning to drugs or medications to deal with stress compared to the less than 1% risk of getting coronavirus and the less than 1% of 1% of them having a fatal issue with coronavirus, and the fact that we can mitigate spread in closed areas like a college classroom or like a dorm with really aggressive hand washing and surface cleaning is worth thinking about, because the risks and the benefits are not 100% straightforward. I'm not fully coming out as a pediatrician saying, yes, everybody should go back to college, but I'm definitely leaning that way based on what I'm reading in the literature and looking at the overall risks and benefits of mental health, mental illness, and the earning and educational impact of kids not going to college in the fall. So there you go. All right, let's talk about a couple other good news things about coronavirus. So yeah, we still don't have a vaccine, but I'm much more hopeful that some of these 100 companies that are working on a vaccine are going to succeed. And the best news this morning is that the Moderna vaccine did indeed cause an antibody response in the safety trials. So there's 3 levels of trials. There's one to make sure it doesn't kill you. There's a second to make sure that it's safe and look at side effects. And then there's a third that really looks at efficacy. So we're in phase 2 trials for most places now But the good news is that while we don't know for sure if having these antibodies protected people, we do know that the vaccine worked to the point that it gave them antibodies. So that's super good news. And I'm more positive about, that was the RNA virus that hadn't ever worked in humans before, so I'm much more positive now knowing that we've got some antibodies that could be what happens, that one could work. Other good news, I don't know if this is good or bad, but in a German study looking at healthcare workers who had been frontline workers during the coronavirus thing, only 1 to 2% of them actually had antibodies. So one thing that means is that they did a good job of gowning and masking and washing their hands. But the interesting thing was 20% of them thought they probably had antibodies. So this is a result that has been duplicated in other places. More people think they're immune than actually are. If you talk to any of your friends who have had a cold or some kind of illness in the past 3 months, guarantee you 80% of them are going to say, you know, and I bet I had coronavirus. But when they get their antibodies tested, they didn't. How do I know? Because I had a cold and my husband had a cold. This is anecdotal, but I was pretty sure I've never felt anything like this before, and nope, negative antibodies. It's not just us though. Many people think they're positive and have not. One thing this implies is that we have to be careful about risky behaviors, because thinking that you're immune is not the same thing as being immune. Along those lines, another study that was interesting to me was that the amount of antibodies circulating actually did not correlate with how severely you are infected. So you can have people who are asymptomatic but have a strong antibody response, and people who had a mild response and or a really bad disease and then didn't have much antibody response. So this is still a weird disease. But I will say that the good news is that it does seem that the people who get really sick are responding to T cells that are going too crazy and then causing cytokines, particularly IL-6 and IL-4, that are going too crazy to attack things. And the reason that's actually great is because the studies that have looked at a couple different kinds of immunosuppressants for psoriasis, for rheumatoid arthritis, a bunch of these injectable biologic medicines are also working to decrease the severity of COVID. There was a study in Italy that decreased severity of ICU patients and got 94% of them home using solivimab, they all end in mab, which is like for antibody AB. So I think that we are very soon going to be having a regimen, a routine to give people a single shot of an immunomodulator in the emergency department and take care of decreasing severity for a lot of people who are at risk. So we're getting there. We're not there yet, but we're definitely getting there. And I think we all could use a warm hug. So I'm going to put our pain care partners heatable rice weight around. The warm hug, and this is from our therapeutics. And then finally, just want to say that if you are a physical therapist and you have patients who are unable to get their knee replacements, or they've been waiting for their backlog of optional surgeries that have accumulated, we can help you out with additional materials and discounts for VibraCool. And our VibraCools are all still being shipped with pain care packages, including a What Works for Pain guideline, different samples. And if you have not yet done so, if you are having pain at home and if you are stressed out and unable to exercise and things are just accumulating, if you haven't started with meditation and magnesium, those are probably the two biggest combination actions you can do. So magnesium between 250 and 500 milligrams a day. It takes about 3 days to start really working well. And then meditation, even 5 minutes a day, has been shown to have a benefit on stress levels and on pain. Well, 10 minutes for pain, but start with 5. You'll like it. You build up to your 10 minutes for the pain management. I think that's all I've got for you today. We will have another visit from the fantastic Dr. Keith Cronin to talk about specific physical ailments. So if you've got a particular part of your body that you need to do some physical therapy on and you're not sure the best way to do it at home, let us know, put something in. And until Wednesday, if there are no questions, then I will say that more than ever, I am convinced it's going to be fine.